Hi, it's Chris McGee with Mac Media TV, and today I'm coming to you from Jacksonville, Florida, and I'm excited because today we have one of um, the best LASIK surgeons in the world, world-renowned LASIK and cataract surgeon, the surgeon's surgeon, Dr. Arun Gulani from the Gulani Vision Institute in Jacksonville, Florida. And this is actually going to be the first in a series that Dr. Gulani has graciously agreed to do with us called See Clearly with Gulani. Dr. Gulani, good morning. How are you?
Good morning, Chris. It's my pleasure to be here today.
Hey, thanks for taking time out of your Saturday morning. We really appreciate it. And to help educate us and get us some important information, I'm going to get right to the point here. How should somebody go about selecting the right LASIK surgeon?
So it's very important at the start of our series that I'm going to emphasize on this many times in our future series too, that surgery is an art. And there are more than one techniques to help people see without glasses and contact lenses. LASIK is only one among 23 laser vision techniques, which are among 48 vision corrective techniques and combinations to help people see without glasses or contact lenses. So once you think about that, you realize this is actually a huge plethora of choices that should be designed to you, as opposed to being offered only one LASIK surgery, very similar to being offered only a hot dog or a burger for lunch. You need to have what's the best surgical option for you. Don't get limited by what's being offered by a particular place. Maybe that's all the doctor knows, and that's not the right fit for you, even if you slip into it as a candidate. So to me, the most vital thing is first find out what you are best deserving for your situation, the health of your eye and your refractive error or your glasses prescription. And that surgery, whether it's LASIK, laser vision techniques, or other lens-based techniques, are designed to you, keeping your safety and your best outcome in mind.
So you mentioned something there that I know that I wasn't aware of, and I've had LASIK surgery. So it's really enlightening. How many different laser, 48 did you say?
There are 23 laser techniques, different techniques. Then if you go into technologies, that subdivides even further. Being a teacher of these techniques, I teach doctors how to utilize the technologies, tools, techniques, and then design it to each patient so uniquely that you are so confident of giving them their best, not the only thing that you know, but the best in the patient's interest.
Well, that's awesome. So the best in our interest, not just something that we're seeing in a Groupon or advertised in the mall. That's like a one size fits all, I'm assuming, and we're not going to get that kind of service, correct? Or am I wrong?
Again, this is where the patient education is so important. When the patient is looking for options for leading life without glasses or contact lenses, do your research. Do not pick up the phone. There are no deadlines. Do not fall for financial incentives or deals. All that's important. But more important is the fact that this is serious surgery. It's your eyes. As somebody who treats complications for surgeons from all over the world, I cannot underscore this important, very important research that you must do before your surgery. Find out more about your surgeon. That is the most consistent aspect of success that I have seen as a teacher to LASIK surgeons. Technology, everything is great, but find out who the surgeon is. What are their results? When you go in for a consult, you get to see the surgeon, or you're just being screened to see if you're worth their time. You must insist on seeing the surgeon. Sit down with the surgeon, ask every question you have, because remember, this is not an emergency. This surgery is elective. Take your time. Ask all your questions. Find out if the surgeon will be there for you before, during, and also very important, after the surgery, that they're available to you, that they are going to monitor your progress as you heal. Ask a very important question. Hey, doctor, I agree, understand that everything's great, but what if something goes wrong and I have a complication? Can you handle it? See, look for your doctor's answer. Are they going to ship you somewhere, or have they handled complications? To me, that is very vital, that you be comfortable that your surgeon can, one, design surgery for you because they do many different techniques. Second, they can handle any untoward outcomes and therewith make you more comfortable, and also are dedicated to taking you to your best vision.
Well, I think that that's so important. I mean, making sure that you actually meet with the surgeon. From personal experience, I did not, but I didn't know any better. So, I mean, I think part of this whole series that we're doing here is educating the patient, the consumer, right? Because an educated patient is an empowered patient, and then they can help be responsible for their care or knowing what happens afterwards. You mentioned something in there, and I just want to back up a little bit. You mentioned that you correct complications of LASIK surgery. Can you tell us a little bit about that and what kind of complications?
This is a very important point, Chris, because many patients, like you said, do not realize that this is serious surgery. Just because it may be done, it takes a few minutes. And yes, in most cases, LASIK is so nearly, you can use the word efficient and predictable, that many patients do well. Well, here is a point to think about. Many of these patients don't know they could have seen even better had the surgery been designed to them. So if you come from wearing glasses and your vision is horrible without that, any improvement is an improvement. But you still didn't get the best vision. I call this leaving vision on the table. So many patients don't realize that just coming from, let's say, a black and white TV to a color TV is a great improvement, but guess what? You could have had an LED color TV and in 3D. So that aspect of vision must be tapped. How do you tap it? Your surgeon must perform the technique best suited for you, not what they are known to limit themselves with. Important thing also stemming from this is, if the surgery is done on you, where you were basically made into a candidate for the only technique the doctor knows or a certain place offers, chances of complications go up because you are being literally fit into a cookie cutter. Now, if the surgery is designed for you, the chance of complication becomes extremely low because everything is kind of tailored to your health of your eye, to your refractive status, to the outcome goals that you want. So complications that I see, keep reminding patients that this is serious surgery. Yes, you can have side effects and outcomes that are so bad it could affect your lifestyle forever. Having corrected complications for surgeons from all over the world, I keep seeing the same thing. The most common causes, same surgery on every patient. So yes, please go into surgery, a little more serious, well researched. There is no rush. Don't fall for deals. Most important, get comfortable with your surgeon.
Yeah, and I think the powerful thing there is what is best for my eyes, for my lifestyle. And I didn't know I could have had 3D or LED. I was just given that. And I'm just speaking from my personal experience. But I do appreciate that. People, you mentioned on it just briefly there, but patients fly from all over the world to see you. Surgeons fly in to have their surgery done by you at the Gulani Vision Institute. Why do they do that? I mean, I think we know a little bit more now because of your last answer, but when it's readily available at a mall or in a Groupon, why are people flying from all over the world to come to Gulani Vision Institute?
Most importantly, think about any senses in our body, Chris, and you'd think the eyes are the most important, and that's correct. I mean, if you were blind, no matter how much money you have in this world, it doesn't matter. It's over. So people are aware that their eyes are very important senses, and they do want the best surgery on them to get the best potential to see without glasses or contacts. So when they do their research, many patients now are very diligent, plus internet has made it so transparent, like your series that we're doing today. There's so much information out there that a patient can be very well educated about, oh really, looks like this is the latest technology, here's a doctor with credentials, he teaches others, he fixes complications for others, he's invented this stuff, and you know what, I can fly. So patients now, and doctors in particular, of course, because they are more aware, are flying because once they research about what they want as the best, there are no barriers to get there. Now, like I said, many cases of LASIK are very successful as a routine, but to me that is unacceptable because of my concept. You left vision on the table.
I love that, and I think we're going to leave with that, and I want, if you tell me, because this is a series we're doing together, should we start our next one with you left vision on the table and talk about that, or do you want to talk about a different topic like cataract surgery?
Either way, Chris, we can left vision on the table is important because that tells you a very important question LASIK patients have. When I have it done once, doctor, is it over? Like, am I now stuck with this? No, you're not. Again, if your doctor knows techniques, once you hit 40 and you cannot read, he does another technique. Once you hit 60 and you have a cataract, he does a cataract surgery, puts in a lens that moves. So again, you're 20/20. The main important thing here is every eye surgeon to me is a vision corrective surgeon. They should be able to fix and maintain you at that vision for the rest of your life. So the topic can be taking vision from having had previous LASIK, or we go into cataract, or correcting complications, or options for previous refractive surgery. Sure. And most important, Chris, is a topic very close to my heart. It's called not a candidate.
What?
Many patients are told that, but believe me, the most important reason again is because they were offered only one surgery. So that's a very provocative title, not a candidate. And the answer is everybody is, as long as you're healthy, and it's just the surgery that has to be designed to you.
Okay, we're going to talk about both of those things, leaving vision on the table. Actually, three things that come to my mind right here. Can previous LASIK surgery be corrected? What's near and dear to my heart here, because my vision has gotten worse, so I want to talk about it, is continuing to get to 20/20, and then not a candidate. Does that sound good? We're going to do that next time?
Absolutely.
All right, Dr. Gulani, thank you so much. This has been powerful. I appreciate your candid information and really just spending the morning with us. Really, from the heart, I really appreciate it, and thanks for coming on.
It's my pleasure, Chris, and once again, I'm a true advocate. It's a pleasure for me to educate, and this is just one more platform, and I'm always available to anybody with any questions.
Great, and you can be reached, Dr. Gulani can be reached at GulaniVision.com or 188-LASIK-16. And you can go to the website and get a lot of information. I've been there. It's deep. That's why we started this series. So thanks for watching, everybody. Once again, Dr. Gulani, we'll see you next time.
Thank you, Ken.
All right.